We're so fortunate today to have our elected officials with us to begin a conversation about what are the mental health priorities for us in this community and what are the mental health priorities in the General Assembly. And to identify those needs and start that conversation. So we're thankful that you're here. Thank you so much for that. And so I would like to turn it over to you and let you have a few moments.
And I will just be a few minutes. Thank you for having me and thanks for being here. One of the things, the most important things that happens for me when I come to an event like this is I learn. And you're already doing a lot of the things that need to happen. Step Virginia, Ms. Harrison, one thing you point out, the 40 CSBs are as disparate as night from day. They're very different. One thing, they're not different not only because of the needs of the community, but because of the willingness of the community to pay for those needs. Now, Pablo, you all have done a good job here. You've done a good job, Mayor. But there will probably be more asked of you. Because when Step Virginia passed in 2017, we knew that ultimately the cost of that would be around $200 million a year. We are not there yet. The state's going to do its share. We've commissioned a study through the Joint Commission, or JLAR, Joint Legislative Audit Review Commission, to figure out how best to pay for mental health services. You know, with school funding, there's a formula that nobody likes, but it's equally fair, equally unfair to everybody in the state. It's basically, it's built to determine how much a locality can pay of the standards of quality for education. With mental health services, the only formula is that we look at what we paid last year, we figure whether some inflation should be there and whether we have a few extra bucks, and it really doesn't make any sense. So you end up with functional CSBs in some areas and non-functional CSBs in other areas. You know, we started this journey 5 years ago to transform the system. And Step Virginia is the most significant thing we've done because it's going to require us to come up with a significant amount of money. In the last 5 years, we've increased funding for mental health services around $90 million. But we still have a long way to go. And we're going to have to figure out a better way to allot that between the state and the localities. There are several key principles we're working toward. We have a system of 40 CSBs and 10 hospitals. They're not really connected. And we've got to figure out what the system needs to look like. The 40 CSBs, is that the right process? As Ms. Harrison said, this one's been in existence since 46 years. So your 46 years, you were one of the last ones to come on board, I guess. The older CSBs are, in the range of 55 years. President Kennedy in 1962 signed a Community Mental Health Act. And the whole idea was to deinstitutionalize people and provide for services in the community. Well, unfortunately, the dollars didn't follow the deinstitutionalization to the communities. So we've ended up reinstitutionalizing a whole lot of people in jails and prisons. The jails, and John, you can confirm this. I mean, our numbers say that 24% of the people in our jails, local jails, are serious mental illness. 16% of the people in our Department of Corrections have serious mental illness. But if you add addiction to that, which is a serious mental illness in my view, the numbers go way up. 97% of the kids in our Department of Juvenile Justice's custody have either serious mental illness or substance abuse addiction. We've got time bombs on our hands, in my view. Now, so we ultimately need to figure out what the system looks like. We have 10 hospitals, 40 CSBs. Is 40 the right number? Are the service areas divided up properly? We haven't figured that out yet. What's the governance going to look like? The governance, is going to be guided on what the funding should look like. And I hope we get a lot of direction from JMARC this spring on that. In fact, in the 10 hospitals, we have, while there's been a lot of angst the last couple of years because we've had a crisis in hospitalization. We've had a crisis in our bed space. And so this is not an issue that we can lightly address. But we spend, on average, states spend about 22–23% of their mental health dollars on hospitals. We spend 50% of our dollars on hospitals. Those are dollars that could be flowing to our community service teams. They could be flowing to provide services in our communities. We've got to figure out, I think that's a product of two things. Number one, we probably, Emmett Hanger had a budget language this past time to right-size the hospital system. We probably have to right-size our system. Every time we've talked about closing hospitals, it gets hung up in the politics of jobs. The hospital is jobs in the community where it exists. But ultimately, we have to decide whether we want to spend a couple $100 million to renovate old hospitals, or we want to focus instead on the people that need the service and put the money in the communities. The jobs, I think, are going to be about the same, but they might look different. So we have to figure out what our system is going to look like. We have to figure out what our CSBs look like and how they're funded. And we have to figure out what our hospitals look like. I was fortunate this past Monday to be with the governor down in Dinwiddie County. The Central State Hospital is where our forensic unit is. It has a significant role in our hospital system. But it's also the first psychiatric hospital for African Americans in the country. It was the first one established. It's got a historic role. It's got a role in our criminal justice system. But if you go there and you compare physically Western State and Eastern State, Central State's held together with Band-Aids and duct tape. It's hard to imagine people actually getting well there. It's hard to imagine being able to recruit employees to Central State Hospital. So the governors, we rejected their plan to rebuild it in 7 years' time. We demanded that it be rebuilt, but they had a 7-year plan. That just wasn't fast enough. So they've come down with a plan that's a little bit cheaper and going to get built in 5 years' time. That's the one capital project I'm committed to in the hospital system. The rest, everything else is on the table. We've got to figure out what our system looks like. The second thing is Step Virginia. Ms. Harrison, we took the list of mandated services from 2 to 10, ultimately. The first one was same-day access, and the last CSB, I think, was Danville, Pennsylvania County. They came on board this spring. So all 40 CSBs now provide same-day access. And think about it. Ms. Harrison said it was a 50% show-up rate for people on their appointments. If a person in crisis or near crisis shows up in the CSB and they're told to come back in 2 weeks or 4 weeks or whatever for an evaluation, that doesn't make any sense. That the person's not going to show up. They're in crisis, they're hurting, they're not going to be there. Same-day access, the evaluation, you get a plan in place for treatment, makes lots of sense. It's an expensive proposition, but we have a lot more expensive work to do. If we're going to, that probably is the most important thing we have to do right now from a budget standpoint, is figure out how to pay for the rest of Step Virginia, how to make sure we get that done. And really the third thing is this notion that we've reinstitutionalized a lot of people in jails and prisons. We were talking earlier, San Antonio, Texas, 1.8 million people, 2,300 police officers. All of them are CIT trained. 95% of the people in the surrounding Bexar County, 95% of the police officers are CIT trained. They say, they claim that they save about $10 million a year through jail diversion. That should be the model. I was really pleased to hear about the number of people here that are CIT trained, but that should be our model. We've got to figure out, my friend Ken Stolley that I served with in the Senate, Steve's friend, Tony's friend, Ken Stolley used to say that, and now he's the sheriff of Virginia Beach, that when we can't afford to incarcerate everybody that comes to our system. We've got to figure out who we're mad at and who we're scared of. And the people we're scared of, those are the people that are incarcerated. The people with mental illness, we've got to figure out how to divert as many people as we can. Now, obviously, when they hurt somebody, they're going to wind up in jail. I don't care how sick they are. They're going to wind up in jail. So, but we've got to find out, we've got to figure out how we provide them treatment while they're in jail. Now, I was pleased to hear that you've got somebody in the jail, because there are lots of jails where I basically had to get a court to order this local CSB to come to the jail. And the work I've done, in my cases, CSBs will have no interaction. As I said, they're as different as night from day, one to another. So I'm glad to hear you're there. We've got, the third thing we have to do is figure out, because 98% of these people, more or less, are going to be released at some point. We've got to have a discharge plan in place. You know, a discharge plan in place, because if they don't have access to treatment when they get out of jail, they're going to wind up right back in jail at the taxpayer's expense. That leads to an intractable problem almost. We've got about 140 people in these precious hospital beds that have been ready to go home for 6 months or more. They're better. They're ready to go home, and they've got nowhere to go to. The extraordinary barriers to people, and you know, I would suggest you have the same thing in some of the jails and prisons. They're ready to go home, but they've got nowhere to go to. We've got to figure out how to provide ultimately some housing for some of these folks, to provide them some long-term support. But it's crystal clear one of the surest ways to provide somebody some long-term wellness is stability, provide them stability. And so we've got to figure out a lot of things. But that extraordinary barriers list is one of them. I look forward to your questions. And my friend Steve Landis, I guess, is going to educate everybody about the money now. He brought several billion.